education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand, promoting change with passion and might, advancing skills.
Hi, good afternoon, everyone. It is my pleasure to welcome you all to this Innovation Spotlight, where we will be exploring an essential and transformative topic preparing for a healthy pregnancy. This topic touches lives in the most profound way. I would like to use this opportunity to talk a little about Dr. Wusu Institute. At Dr. Usu Institute, we are committed to advancing workforce skills and promoting technological innovation through education, training, and research. Transform your future with our expert led online and on site training programs. Whether you are looking for to master digital literacy and computer skills, harness the power of IE tools, creating engaging content through video blogging or design stunning websites, we have a training tailored for you. We also offer after school classes for kids in math and computer science to equip the next generation with essential skills for the future. For more information, visit doinstitute.org or contact us on 05391 or 0207 115446. I'm taking the numbers again: 0539 or 0207 115446. A special thanks to our sponsor, Arise Graphic Professionals, your trusted provider for graphic design, web design, and hosting services. Now, back to our main innovation. Bringing new life into the world is a beautiful journey, but it also requires preparation, knowledge, and the right support system to enhance this journey. Today, we are here to explore how innovation, medical advancement, and holistic approaches can help create healthier pregnancies. It is my honor to introduce our esteemed guest today, a highly experienced and passionate midwife, Miss Krama Margaret. She is dedicated and experienced registered midwife with 11 years of expertise in maternal and newborn care. She holds a Bachelor of Science in Midwifery, equipping her with the knowledge and skills to provide high quality care to expectant mothers and newborns. Throughout her career, Ms. Kramer has been committed to ensuring safe pregnancies and deliveries, offering compassionate support to mothers and families. Her extensive experience in midwifery has made her a trusted healthcare professional, dedicated to improving maternal health outcomes through patient-centered care and best practices in childbirth and postnatal care. Today, she joins us to share her wealth of knowledge on preparing for a healthy pregnancy. Please join me in giving a warm welcome to Miss Grandma Margaret. Thank you for joining us, madam.
Thank you. Good afternoon, good morning, good evening, wherever you're watching us from. Our topic for today is preconception care. Preconception care, pre means before, conception means pregnancy. So, together, preconception care is caregiving to couples or a woman before they embark on a pregnancy. And it's a period of 3 months to 1 year. So, in case you want to get pregnant, let's say in next year, 2026, you can start preparing from now. And it has a lot of benefits, which includes it reduces birth risk, birth defects, and miscarriages. It improves maternal and fetal health care, and it enhances fertility chances and then chances of conception. It enhances early detection and management of medical conditions. Nti like mfasodeɛ a ɛwɔ preconception care no ho ne sɛ ɛprevente miscarriage a dodoɔ no yɛtae ka ne sɛ yɛapɔn wɔ otwi kasa mu anaasɛ nyinsɛn no asɛe. Aha nti sɛ wopɛ sɛ wonyim na sɛ saa ɔhaw yi sɛ ɛbɛyɛ wo nyinsɛn no ɛnsɛeɛ a wobɛtumi asiki such care to enhance proper outcome of the pregnancy. And also, it helps prevent the transmission of STDs and other infections. To say, Bia, if your partner is having, let's say, gonorrhea or syphilis or any other condition, seeking such care will help you to detect it and receive early treatment because some of the STDs can produce abnormal fetus or can lead to abortions. Okay, let's look at some of the components of preconception care. We have reproductive awareness, medical screening, um, genetics screening, teratogens, and environmental things. Terms need there so to have STD screenization, family planning, nutrition, psychological screening, other psychosocial or substance abuse. Okay, let's take a reproductive awareness. So reproductive awareness means that fertility for women. After you pass a particular age, you cannot give birth again, or you can't ovulate, or the other you can get into menopause. So you can't say you will start giving birth after 50 years, where you are not having your menses monthly. So fertility in women decreases with increasing age. So as a woman ages, fertility decreases. And as a woman ages, the rate of giving birth to an abnormal baby or abnormal child also increases. There's a graph there. Sɛ ɛfa ne sɛ obi a wadi 20 years a ɔpɛ sɛ onyinsɛn no, the chance sɛ obetumi anyem no yɛ higher than sɛ bi a obi a wadi 42, 45 ɛkɔ. Because women have fixed eggs a ɛwɔ ovaries mu nti every month you ovulate and every month you get your menses. Once you are getting your menses monthly, it means your eggs are getting finished. So once the eggs are finished, you cannot conceive again. So we should consider our age when it comes to giving birth. And as compared to men, mmarima no deɛ wɔn bɛtumi adi 60 years koraa wɔn bɛtumi impregnate ɔbaa but mmaa no deɛ after menopause you are done with your childbearing ages and woyɛ below 18 years nso a ɛno nso so ɔbaa wobɛtumi anyi but your risk of wobɛtumi anya other complications. Nti yɛwɔ term bi say like women in their fertility reefer is between the ages of 18 to 35 years. Even though within that time you can get a complication, but it's not as much as those after 35 years and then below 18 years. Okay. And we have another chart there, which is showing maternal age and then the risk of Down syndrome, which is another problem, which most of us in the developing countries are going through. You cannot be screened, and even if you are able to screen, you can. There's nothing that you can do it in our area. It's not clear, but what it is showing is that your chance of getting a child with Down syndrome increases with increasing age. So once you age, your chance of getting Down syndrome too increases. So with the last one, it's 50. If you are 50, your chance of getting such a child is one out of six women. So if let's say a man six anymore, a move back with many Down syndrome, and Down syndrome is a chromosomal abnormality, which you can only prevent it by not giving birth at that age. Okay. So next on slide is medical screening, which is another component of preconception care. So with the medical screening, we have diabetes, hypertension, and then epilepsy. It is many, but I'll be talking about only the three of these. So babies born to insulin dependent. So diabetes literally means having elevated blood glucose. anaasɛ bi a wokɔ clinic na yɛka kyerɛ sɛ bi a wowɔ asikyire yareɛ wowɔ asikyire yareɛ. So if you have this condition na sɛ bi a wo fasting blood sugar no yɛ high, your chance of giving birth to an abnormal baby is high, or your risk of getting a congenital abnormality for your baby is very high. So blood glucose control before pregnancy is important, as the teratogenic effects of hyperglycemia occur during organogenesis. Yɛka sɛ organogenesis it's just a big term, but time a baby no start forming, the organs start forming. So as early as 8 weeks, bosome nawɔtwe nwɔtwe ntam na baby no started forming. At that time, the baby is very sensitive to a lot of things. So yeah, sometimes baby na nim so munyim. Most of them aren't aware that they are pregnant. They might be taking a whole lot of things. But if you have diabetes, you should make sure that your blood glucose is low or is controlled before you get pregnant, because high level of glucose in your bloodstream can lead to fetal abnormality, and it can lead to IUF disease. Your baby can die in your utero, okay, and you can have a very big baby with a lot of complications, okay. So, and if you are a woman, a pregnant one, and you are having diabetes, you can get retinopathy, or you can destroy your kidneys as well. So seeking preconception care if you are a diabetic client is very important. And even if you are not a diabetic client, it is very important that you know your blood glucose before you get pregnant, since it can have a major effect on your system and your unborn baby as well. And you have hypertension. Hypertension, in the other hand, too, can reduce fertility in both men and women because of poor blood supply to the vital organs and then reproductive system. Nti sɛ obi wɔ mogyabosoɔ anaasɛ hypertension a, ɛno nso ɛkwan sɛ obetumi, you can get more complications as well. You can get preeclampsia, which is another complication of hypertension in pregnancy. And also wobɛtumi anya miscarriages. Nti bia wɔ BP na sɛ wonyinsɛn a, your risk of getting miscarriages will be high, and your risk of getting IUA bisa koraa no bɛwu wɔ wo yam, bɛwo preterm baby, because ebia wo BP ni bɛkɔ soro a doctor bɛka sɛ oh sɛ BP na ayɛ ne deɛ agye si yɛyi wo ba no, ɛnso wobɛtumi anya preterm baby through that. So you have to check your your blood pressure as well during this period. So if it happens you have hypertension, because a lot of people is living with hypertension but they are not aware of it. And you can use this opportunity to check your blood pressure before you get pregnant. Then our next condition is epilepsy. Epilepsy, you can't dream say a triary, a friend a tray. Those having this condition have have problems with their neurons. Like it's connected to the brains. It's like pertain to the brain. It will be with epilepsy and not a child. Also making sure say or be reported to hospital before getting pregnant, because some of the drugs prevent the absorption of vitamin B9, which is folic acid or folate. And this drug also prevents neural tube defects. Into somebody having such condition should seek it so that they will reduce, even if the person is on medication, they will know how to reduce the doses of drug that will be given to her. Next thing is genetic screening. It's another component of preconception care. Baby, I am part of one day as a man in the developing countries. It seems like it's only pregnant the woman that gets pregnant, but it involves two people. Say, Onyuma, o person Onyuma, and I say, we are also no person who blood group. It be a most sickling, and I be a G6PD. ne nyinaa ho hia. GCPD and other conditions like even resource factors is another issue of concern. So with the G6PD, we're talking about G6PD. G6PD deficient. G6PD as it stands is an enzyme that prevents red blood cells from breaking down. This is PD, ɛnyɛ yareɛ, but yɛfrɛ bi enzymes. Ɛmmoa ma nipadua no etumi ɛyɛ adwuma yie. Yɛwɔ enzymes bebree ɛwɔ yɛn nipadua mu. Even ntɛso a ɛwɔ yɛn mu kora yɛwɔ enzyme wɔ mu a yɛtake in starchy foods a ɛboa breaking it down. Saa nso na yɛn mogya no nso so as it stand we have an enzyme. Nti GTSPD an enzyme a protects red blood cells no. Blood ne was still there or white blood cell, red blood cells, any other ones. Nti protecting red blood cells no from breaking down. Okay. Nti more deficient no more say what GCSPD or GCSPD, but GCSPD nankasa at a stand is an enzyme that prevents the red blood cells from breaking down. So those who are deficient of GCSPD, so we call it, the GCSPD stands for glucose 6-phosphate dehydrogenase. So people who are deficient to this enzyme, it can be either partial or full defect. Partial defect or full defect. So with those with a partial defect, it means they have little of that enzyme, the enzyme GCSPD. And those who are full defects, they don't have that enzymes at all. And these enzymes to protect the blood and then blood cells from breaking down. And there are things that triggers hemolysis in people with red blood, people with GCSPD. Ọmọ more GCSPD full defect no. Ọmọ red blood cell. This one say BBM protecting internet tie breaking tie low HB. If it be HB hemoglobin level. Ọmọ full defect in partial defect. Baby na tie low HB because I didn't ever red blood cells who might say break it down. A break it and a red blood cells carry oxygen. Part B or friend hemoglobin is that it is within the red blood cell and on a carry oxygen. If if such person takes some certain substance, it can lead to hemolysis. Hemolysis is moja blood cells they break it. Blood cell be on a lifespan. Some are 120 days. It's after 120 days, na body na kasa a break it down na asa for me for. But almost GCSPD deficiency no. And nneɛma bi wɔ hɔ a wɔfa kɔ mu nipadua mu a ɛtumi affect wɔn. If that person gets infection, bacterial or viral infections, it can cause hemolysis. Ɛbɛtumi ama red blood cells not break it down. And some painkillers like aspirin, they shouldn't take it. If you have this condition, then you have to avoid over-the-counter drugs. And no na total drugstore no. Anyway, no so ujai. Unim o GCSPD status on say was so check now because anyone will be hormone fat. And some antibiotics so and pregnant women who have been going for ANC clinic, they check this type of they do these investigations for them. GCSPD. So those who are partial defect and full defect, they don't give them the SP. So sulfadoxine pyrimethamine is an anti-malaria drug that prevents pregnant women from getting malaria. But because they don't have this enzyme in their blood, they are not giving side drugs. So if you are a pregnant woman and you go for anything because they tell you because of this your condition you cannot take this drug, that is why if they give this drug to you you can react and then it will cause hemolysis, it will cause breakdown of your red blood cells. And there is a particular beans which these people don't take. Yɛka sɛm deɛ ɛka ne adua patram ɛyɛ beans ɛsoso paa mpanimfoɔ no taa de yɛ nkwan. Yes, that's the picture showing. These beans in particular, those with G6P deficiency don't take it. Or more that condition, yeah, the way I'm coming because it will cause hemolysis. And another thing is the naphthalene. yɛka no camphor no. If you have this condition and I say we use to camphor or naphthalene or mothballs, it can cause hemolysis until you should note it. Then next is immunization. As for immunization, what we've been taking is the tetanus. So, but in foreign countries, they take flu, they take measles, and then rubella. Rubella is linked to fetal abnormality, and then it can cause abortions. So in the developed countries, they do immunization. They check if you have immunity to these infections. So if you don't have them, they will give you the vaccine to prevent infection. We have STD screening. STD screening are like sexually transmitted diseases. But baby, I want the year no yɛnyim a na yɛkɔ clinic nti woanyim a amfa wohu so wɔ condition wei. Ebi ne HIV is STD, hepatitis B is STD, gonorrhea, any others, syphilis. Nti no, during this period, preconception, wonyinsɛnyɛ no, wobɛtumi aseki akɔyɛ saa labs wei if you only want to get pregnant. Wobɛtumi akɔyɛ labs wei sɛ bia if you are not having such conditions, then you can embark on it. And we have medication review. CB or honoma, if somebody is having hypertension or diabetes or any other condition, any medical condition or any other condition, you can go to the hospital and for drug review or medication review because some of the medications are linked to fetal abnormalities. Nnuro no bi wɔ hɔnom a yɛanyɛ ama pregnancy apemfoɔ. Nti te sɛ bi te sɛ BP drugs yɛwɔ apemfoɔ deɛ wɔ hɔnom ɛna yɛwɔ obi a ɔnyem deɛ wɔ hɔ. Nti no wopɛ sɛ wonyinsɛn a anaasɛ wonyim a dɛm nyɛ so nyɛ wopɛ sɛ wonyinsɛn a ɛwɔ sɛ wokɔka kyerɛ wo doctor no sɛ doctor ebi a baabi a woadu deɛ wonyaeɛ a wobɛnyinsɛn na wayɛ dɛn wate aduro no so anaasɛ wa-review wo drugs no ama wo na wama wo deɛ ɛde ma apemfoɔ no bi to prevent birth defects. And we have teratogenic and environmental toxicants. If you are preparing to get pregnant, you have to stay away from such things. Teratogenic agents are substances that can cause birth defect or fetal malformation. Nti saa aborɔfo kakraka wei nyinaa teratogenic ɛyɛ adeɛ a ɛbɛtumi akɔse fetal abnormality. Ɛyɛ adeɛ a ɛbɛtumi ama wawo akwadaa a wadi dɛm. Ebi wɔ a bɛwɔ akwadaa ne part baabi nni hɔ, n'aso nni hɔ. It is why you're exposed to teratogenic. And example of teratogenic, no, it includes some medications. Na make us be a BP no go on my bit me cause birth defect. Into person your mouth so near review mouth. And I be a to say rubella, it may cause birth defect. Every to say toxoplasmosis and also and I to say high glucose level or diabetes na your uncontrolled that diabetes I should still change wo moja nim na kasa no it may cause birth defect eno de enye na edu no sugar na kasa na wo moja nim san make am sugar na kasa it can cause birth defect so it will be a teratogenic at that time. And radiation, high level of ionizing radiation ebi a wo ye adwuma wo X-ray department and baby on use radiations edi adwuma eno no or say obe person yin say so ono mpani for kasa na bia omo you free ho na yes a wonyim a as early as 8 weeks wonyim a first 8 weeks that time na baby no say something go wanyim 8 weeks na person wo dey dro kana wi a some time no wonyim dada that time na baby ni forming no wo fa other substance akobo betimi asesa baby no how the baby is forming. And we have environmental toxicants. These are substances that can harm human health and the environment. Examples include lead and mercury. Mercury na yɛde galamsey no. Mercury yɛde galamsey no, it causes birth defect. Nti no, wɔ area ɔmo yɛ saa nneɛma wei yɛ na person yɛ so hwɛ wo ho yie because you can get it. You can give birth to an abnormal baby. The pictures maybe na you show earlier on cleft palate there are a lot gastroschisis and when I real, all these pictures are real. People have been giving birth to such babies. So you have to be careful if you are living in such areas. Our next component is nutrition. A well-balanced diet supports reproductive health, prevent birth defects, supports fetal development, and help reduce pregnancy complications such as HPT and diabetes. Nnuane no a yɛdi no, ɛno nso so it have a role to play when it comes to preconception care. Okay, it have a role to play. Nti also with the well balanced diet, you take carbohydrates, fruits and vegetables, proteins, and then healthy fats. You should prevent saturated fats. Okay, and add more fruits and vegetables to your diet. So some of the essential nutrients for preconception can include folic acid. Okay, we have folic acid and folate. With the folate is found in fruits, and then folic acid is synthesized. It's a drug form. It's in a drug form. But green leafy vegetables contain folate. Tisibia, contomere, spinach, and then susia and those things. It contains um, folate. But overheating also prevents it remove it from it eliminates it from your diet. So you taking in overcooked food or overheated food, fancy why you aduane no wode akɔhyɛ fridge mu ɛnɛ no wayi no ahiti wate bi no da wɔde anka no akɔhyɛ mu ɛbɛma folate no na reduce koraa wobɛdi raw food. Ɛna iron rich diet rich in iron nso so ɛyɛ calcium and protein and omega 3 fatty acid. Omega 3 no wobɛtumi anya bi wɔ salmon emu. Okay, so with the folic acid deficiency can lead to what we call neural tube defects. Okay, so if you are preparing to get pregnant or you are preparing for a pregnancy, you have to take folic acid 400 microgram. Or if you've had a baby with a birth defect before, one baby already then be that folic acid also have 5 milligram. And then when you over the counter drugs, a preventive birth defect, neural tube defects. Nti no, wopɛ sɛ wonyinsɛn ɛna ɛno koraa nso ɛboa ɔbaa bia because of monthly menstruations no as a woman you can take it wobɛtumi afa ɛbɛboa ɛno nso protect the red blood cells from breaking down nti no wobɛtumi afa ɛna ɛno nso at the other hand too it prevents birth defects like encephalocele, a whole lot, yes. As it is showing on the screen, it can prevent these things. Or it can reduce because there are certain things you cannot prevent. Yes. The one with no head, that one is called an encephaly. And we have the spina bifida and then encephalocele. So if you take folic acid 5 milligram, if then you can prevent such things. And even if you are epileptic client, you should take folic acid so that your risk of getting such babies with babies such as anencephaly, encephalocele, spina bifida, it will be reduced. Your risk of getting it will reduce. So during this period, there are certain food that you have to avoid. Some include fish like shark. Ebi mo shark, but area handling ebi mo be shark. And I say king mackerel, and tuna opoku. It contains high level of mercury. As this species lives in the sea, it stores mercury in its egg. So if you take such fish, you can get mercury in your bloodstream. And mercury too is a teratogenic substance that can lead your baby that can increase your chance of getting a birth defect baby. And processed meat contains preservatives and high saturated fats. Okay, high saturated fat is linked with a lot of problems, HPT and then diabetes. So during this period, you have to reduce your intake of such substances. And sugary drinks like soda it contains empty calories, it doesn't contain any nutrients. So you have to take a food with fiber. Okay, such as beans, like normal beans, not the one I showed on the screen. You can take beans, you can take kontomire and other things. Okay, so next on our topic, our next component is BMI, body mass index. Is the calculation of an individual's weight in kilograms divided by their height in meters squared. Nti BMI na kyerɛ sɛ yɛde calculate bɛ sɛ bi a you are healthy or you are heading towards an abnormal weight. As your weight increases, it increases your chance of getting chronic condition, medical condition like hypertension and then diabetes, and those conditions to affect the kidneys as well. Okay, so during this period, you have to know, you have to do weight management, or if you think you are obese, yeah, so it is calculated like as a those Ghana cards so actually also be at 1.65 meters will be also. So if you get to know your weight, unya wo weight na say fan say we 60 kg we be divide it by 1.65 no times another 1 point. It will be multiply your height na wo Ghana card this no by eno aho. And I say we be multiply it by 2. It will be 1.65 times 1.65. Okay, no we divide weight ni by eno. Ahin na obenyan na ye will be MI. Nti no, wonya BMI of less than 18.5 we are underweight. We are underweight. Nti omo so yɛ underweight nso omo reproductive issues and health issues. And omo yɛ overweight ni obese nso so omo nso so wɔ health issues. Nti no, obi a betimi calculate. Wo de woni mu weight a wokɔ pharmacy shops ni bi omo be bi mu wɔ scale anase wo ben clinic bi ana be betimi a check your weight so that you will calculate your own BMI. Nti normal BMI it ranges from 18.5 to 24.9. It is a calculate BMI na say we are within this range na say you have a normal or a healthy weight. But we calculate now we are more than 20 we are more than 24.9. As we are 25 25 to 29.9 we are overweight. It's overweight no also weight management because it is risk, it is linked with some of the chronic conditions like hypertension and then diabetes, and they have slow metabolic rate which increases their chance of getting but or status for your case say oye bibi kakra bia na wabrɛ. Nti no, if you have this weight, this weight, you should try and manage it and get within the normal range, which is 18.5 to 24.9. So if you have a BMI of 30 and above, then it means you are obese. So if you have a BMI of 30 and above, it means you are obese. So you should start calculating your BMI now so that you know where you are heading towards to. Because having a higher BMI value means you are heading towards chronic conditions like diabetes and then hepatitis. And the way now I say you did I said acquire one way. We take a lot of high glycemic foods like rice. Rice have high glycemic index.
At Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every we take. A brighter future is what we make. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from at Dr. Owusu Institute, we rise and we grow. Building skills for the future with all we know. Through education, training, and research we lead. Advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. From sustainable tech to coding dreams, we're pushing the limits, we're chasing the beams. Empowering minds from every walk of life. Through education, we cut through the strife. Innovation thrives where hard work's embraced. At the center of progress, our dreams are laced. Training today for the challenges near. At Dr. Owusu, we pioneer. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. Through every course, every line we ignite. We're shaping the world, we're guiding the light. With Dr. Owusu's vision clear and true, the future's bright and so are you. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand. Promoting change with passion and might. Advancing skills in the morning light. Center for Skills Development, we persevere. At Dr. Owusu, we make it clear. Get there from here. Through Owusu Institute, where dreams take flight. Through education, we ignite the night. Get there from here, we're leading the way. Building tomorrow today. At Dr. Owusu Institute, we rise and we grow. Building skills for the future with all we know. Through education, training, and research we lead. Advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations. With every lesson, every step we take, a brighter future is what we make. Get there from here with knowledge in hand. At Dr. Owusu, we take a stand.
Okay.
Promoting
Sorry for-
change with passion and
Sorry.
might.
Let's continue. So, with the body mass index, as I was saying, if you want to do a weight management, you can contact the nutritionist or the dietitian so that you know what to take and the time you take. Okay. So, in conclusion, preconception care is essential. Healthy lifestyle choices matters. Chronic medical condition requires special considerations. Mental health is crucial, and genetic counseling can provide valuable insight. By working together, we can promote a healthy pregnancies, improve birth outcomes, and support the well-being of families. Thank you for watching.
Thank
See
you
you.
very much, Ms. Kramer. We are very grateful for having you on this show. Please, the audience, do you have any questions? Ms. Kramer is ready to answer any of your questions. So if you have any questions, kindly address it. Okay, there's one question here.
Okay.
Miss Kramer, please, someone wants to know that doesn't mean that if you are, let's say, 40 to 50 years, uh, is it the chances of getting pregnant is very low, right?
Yes. Your chances of getting pregnant at that age is very low, but it depends on the individual because some people have late menarche. Like menarche
Oh,
is your first menstruation. So let's say if you get your menstruation around, let's say 18 years, definitely you will get your menopause late compared to someone who gets her menarche at 11 years and it is happening 10 years they are getting their menarche. So definitely they will get into menopause earlier. Okay, so that is an age, so it depends on the individual.
oh, okay, okay. And please, someone also wants to know that is it advisable to do self-medication if you are pregnant?
No, as for pregnancy, it is not advisable because if you get pregnant, you can get in a state of emergency at any time. Even if you don't have any chronic medical condition, you can get into a state of emergency at any time. You can start bleeding at any time. So, if you are pregnant, you should avoid self-medication. If you have any problem, you should visit your antenatal or visit your hospital or inform your doctor or midwife for advice.
Oh, okay, okay. Thank you very much. And please, some pregnant women sometimes when they get pregnant, their system or like they don't really take any vegetables, fruits, and all that. Like they love taking sodas, like drinks and all that. Like, is it advisable?
No, it's not advisable. But during antenatal time, they give them supplements. Like they give them folic acid, multivitamins, and those drugs. But it's not advisable to take empty calories like those drinks because what it's going to do is going to elevate your blood glucose and put you and your baby at higher risk. And also, you taking such nutrients will also lead to anemia. Your your hemoglobin level will reduce. So, if you have such problems, you visit your midwife or inform your doctor or midwife.
Oh, okay, okay. Thank you very much.
You are
Okay,
welcome.
as we wrap up today's session, on behalf of my team and I want to extend a heartfelt thanks to you to our incredible guest, Miss Krama Margaret, for sharing such valuable insights on preconception. A big thank you as well goes to all attendees for being part of this conversation. I hope today's session has sparked new ideas and perspectives. Let's continue exploring, learning, and driving positive change in our field. A special thanks to our sponsor, Arise Graphic Professionals, your trusted provider of graphic design, web design, and hosting services. Once again, thank you for joining us. Stay connected, stay inspired, and we look forward to seeing you at our next Innovation Spotlight webinar. Have a wonderful day. Bye bye.
At Dr. Uzu Institute, we rise and we grow, building skills for the future with all we know. Through education, training, and research we lead, advancing workforce skills, planting the seed. From digital literacy to tech innovations, we're shaping minds for tomorrow's generations.